How acupuncture works for all people. Hi everyone, I'm Dr. Mana, acupuncture specialist, and today I'm going to talk about the benefit of acupuncture for all people. If you are a senior citizen, if you are having old parents living with you, if you have to take care of some old people as it may be your job, or if you're caring about yourself and want to have a healthy old age life, I suggest you to listen to this video very carefully. As a person becomes older, many problems arise. But these problems are not the old age problems. Many of these problems were existing within you, and as you became older and weaker, they got a chance to trouble you. If you want to be a healthy old person, you should take care of your health long before you become old. But how you can take care of your health? And what if already you're old? What is in your hand to do for your health at any stage is to take care of your diet and your daily routines. In this way, all the metabolisms which are occurring in your body are going to be controlled by you. Are these enough? Not usually. Now is the time that acupuncture assists you. Before doing any acupuncture treatment, one must go through the complete acupuncture diagnosis. This diagnosis will take 2 to 14 hours, and it's very important to do it, especially if you are old or if you are sick. To know more about this diagnosis, you can search for Dr. Mana's Image Parts Diagnosis Method or Dr. Mana's Organs Image Parts Diagnosis Method, or you can ask me directly. However, I'm going to make a video specifically about my diagnosis technique. After finishing the diagnosis, we will have a clear image of each and every part of your body. We are going to detect the complete health statement of all the organs and all the tissues of the body in molecular levels. Okay, maybe now some of you got confused and want to know how it is possible. But it is possible. Believe me, it is possible. I'm trying to teach some others, but it's really difficult to learn. And we'll discuss about it later. Maybe the best way is, if you get a chance, just you come and practically do it. Now, if you agree with me that through acupuncture diagnosis, at least through my diagnosis technique, we can detect everything about your body, you are understanding that we are going to have a clear image of your body, clear understanding about the health and unhealthy situations of each organ, each cell, each tissue, each molecule, each chemical reactions. And it's a perfect thing. Before doing any treatment, we should know this. That we may not get all this information through any other techniques. If we are going for some CT scan, for example, or some MRI or some other molecular lab, we are not going to detect that much. I just give you one example. When we are going for cancer diagnosis, or we are going for one genetic test, for parental genetic test or some other genetic abnormality test, sometimes we fail and we cannot detect that one. If one couple go and they want to do some genetic tests and want to detect and understand and determine about their next generation, we may not be able to give them the right answer. And they also maybe get one unhealthy child or a child which maybe looks healthy but having some problem which genetically came to that person, came to that child. Fine? And same when we are going for some cancer diagnosis, we may not be able to detect that condition. If we are having just few cells, few cancer cells, this side outside of the body, or maybe in one part of the body, just few cells. Think, for example, we are having few cancer cells in liver. Is it possible we detect that one with any test? It's not possible. Rather than we take whole liver, and even that time we won't be able to detect it, and we will fail to detect that one because it's just few cells. And when we are going through this diagnosis, which I told you I am going to explain it later, we will get a lot of information about each cell, about each molecule. When we are having one clear image of that body, the whole body, we can judge it better, we can decide better what treatment it needs. One of the reasons that when we go for the treatment through some other techniques rather than acupuncture and we are not successful is basically we didn't diagnose the problem correctly. We found out the bone is weak, but we could not understand why it is weak. We found out some tissue is growing more, but we didn't understand exactly what is the reason. When we are going through this diagnosis, we can understand many things. We will gather a lot of information, and it's a lot of help. Even if we don't treat that person, we don't give any treatment for that person, but he or she will understand about his or her situation. They understand what they should expect next, what is going to come next month, what is going to come next year, what they should be waiting for, and how they can prevent that one. It's not going that suddenly that person get heart attack or get a stroke and they get worried. They will be knowing about it, that what they should do, that it doesn't happen. And when we come to the old stage, few things are very important. One is that person to be healthy, completely healthy, and do his own work. And the other thing is, if even that person is not healthy, that those health problems, those disease conditions, those bad conditions which should not make that person to stop, should not make that person to lie on the bed, should not make that person often to go to hospitals, often needs help, or not to be able even to be on the feet and do her personal work. We are going to help for that person that to do her own works as much as possible. It's very difficult when a person is old, is a time to enjoy his time or her time going outside. If they are having grandchildren, see their grandchildren and do some works more than like what is left over and they didn't do it. They were waiting for a time that they finish those works. Now it's the time that they should enjoy, but instead of enjoying all the time, they should be sickly, or all the time they should be needing help under some medications, going on for some surgeries. And two things is which are very bad when a person is old. First of all, the interest of others for them will be less. Others and even himself or herself are not that much interested that to take care of that person, to let that person also to have a happy and healthy life. And they are going to give a lot of medications, something which is not suitable for that person. When we are young, when we are child, if we take some medications also, and if the body is not agree with that, if it has to be accumulated in kidney or in liver or somewhere in the body, somewhat body can clean it. It's not going to be that much pressure for the body. But when it is old, think that kidney also is weak, the liver also is weak, and we are going to just give some extra things to the body and want it to help. For many of the old people, you saw that they are giving calcium. Is it possible that body use that calcium? Is possible at all or not? When we are doing the acupuncture diagnosis, we will judge that. We will come to this understanding if that body is capable of taking some medicines or taking something orally or through injection or some surgery or anything is required, and body is capable of taking it and using it, not taking it and it be trouble for the body, it be more pressure for the body. And we can help to that person to take a correct path, to make a better decision of what to take, what to not to take, what should be worried about. This problem sometimes will be too much, like if the person having BP, if that person is having back pain, if that person is having eye problems. And our treatments, not my treatment, the general treatments which we are giving for them, is not going to be helping them anyway. See, we should not think that person should be getting benefit from this treatment which we gave just for few years. We should think this person should have a happy, healthy life. And one more thing is there, which is very bad, and specifically the old people themselves will think like that, other than people around them. This is their common words, that we are old, why we should be bothered about it, and especially if they are more than 70 or 80. We are just near to fall in the grave. Why we should be worried about that? Yes, they have to be worried about that. First of all, we cannot say when a person dies. We cannot say, means when we do the diagnosis, yes, we can say for any person, we can say for a child also, we can say for newborn also, we can say, like when you are buying any gadgets also, some cars, some other machinery, you will understand this is going to work for 1 year or 2 years or 10 years, or we should expect it to work for 50 years. For the body also, same thing, we can calculate and say that, and we can determine that this body in this condition is going to live for another 10 months, is going to live for another 15 years. And there is a lot of differences sometimes between what that person thinks and what is the reality. Maybe in calculation, it seems that person is going to live for another 7 years, but she is thinking she is going to expire within few months or any moment. And it's very good that person also be honest with herself or himself and accept the fact that is not something that you can wait for, that like you can't say I'm old and it is going to happen. That is having a very complicated ways of itself. One of the things is that never happens because you are old. You cannot say if my heart stops I'm going to die. That is something somewhat anyhow genetically it is programmed in your body, that this body is going to be expired within this date, within so many hours, so many years. However, we can do something to speed it up. If you are going to live, for example, if that body is made to be expired after 70 years, like 71 years, for example, we can speed it up sometimes. Like if you damage some organs, some tissues, if you take something to spoil something more, you may speed it up and make it 60. But it doesn't mean that if you take care of your health, you can make it over that. See, generally, what the body made to work for certain years, it's going to be that till that date only. It cannot be more than that. Sometimes with some medical help, we give extra oxygen, extra some help, maybe few months, we can just extend it. It's not possible to make a body which is expired, which is the date of that body is over, to make it to live for much longer than that. Then just please forget about this idea that if I take care of my health, it's going to be prolonged. But sometimes, see, this idea can be helpful sometimes. Like for example, say that person is is too old, but the expiry date of that person is another, for example, 5 years. But already the body is extremely weak, the bones are extremely weak, but the body is going yet to live. And in between, something will happen. I think now the brain will just get problem, or kidney gets some problem, or heart gets some problem, and it can make that person to die earlier. And now she can just take a decision that, do I want to live till the last date which is possible, and in this last 5 years I may get some other problem. Some other problem means because of the weak bones it may break, and she may be on the bed, he may be on the bed, and being depending on someone. Or no, I can just see that I can maintain those bones yet and live with that. And if I cannot make it, I just want to go for a regular treatments, just make my heart okay, make my brain okay, make my kidney okay, and I live for another 5 years. Just let it go, whatever happens in between. I want to be on the bed, I need some assistance for my daily works, that is okay, let it be, but I want to be alive. That is the decision which that person can take. But I'm not talking about this group, which they have to take a decision when their expiry date is not yet due, they want to, for certain reasons, since they have a lot of issues, they decide to go earlier, and they can do it. Like that person got some heart attack, and it can go earlier before anything happen next month or next year. I'm not talking about these groups. I'm talking about those old people which they are going to be sickly till end of their life, and they're going to be having trouble with themselves, and others are going to be trouble with themselves, with them, like with these old people. And there are many things will happen. One is about the finance, how much they have to spend, and many other things which I think if you just think about the old people, if you're old, just think about it, how many times others should spend for you and how they behave with you. Some of the people even think like that others should like us. We were their parents, we were their grandparents, they should like us, they should take care of us as we loved them when they were small. No, that is completely different, because when it is a child and it's a small baby, taking care is very different. They're cute, not only the parents, others also will like them. But the old person is very different. Old person, if it is on the bed, if it is having some brain problems also, not understanding also, and ugly body, difficult body, diet is different, smelly body, it is not that easy to take care of that type of body. And then you cannot expect your kids or your grandchildren to be loving you so much and ready to take care of you 24 hours for even years. That is not at all a good decision. And many of the old people are thinking, now I may have old, no, anytime I may die. But no, that may not happen. That in majority of the old people around you, if you look, that did not happen. They got a stroke, they got heart attack, they got some other health issue because of the BP. They were high BP, they were in some problems because of their bones, they were in some problem because of their cancer, they were in some problems, and they did not die. They were just on the bed, they were just rushing up to the hospital, they were just taking the medications, surgery after surgery, care after care, and they were just not good after that. What we do for the old people in acupuncture, first of all, is we maintain the health of each organ and each cell, how much is possible. What is our aim for the old people is to let them to be on their feet and not to be dependent on someone else. If they are already past that stage, like they already got heart attack or they already got a stroke and they cannot move their body, it's very difficult for them, we'll try to bring them back. But before that, better they do the treatment. Before that, when we started treatment, see, I told you we first we'll diagnose, then we will understand everything about the health of that person. We will judge it correctly. Even some people, because I face even this one a lot, they are having some leg problem, some knee problem. They cannot walk. And yet, they are okay with that. They don't know till end of their life. It may take 3 years, it may take 16 years, how long it takes time. They are going to be either on wheelchair or either they cannot move anywhere. But it's the time that actually they move around, not to be stuck at home, not to call their kids or their relatives or their friends just for health problems, that to take them to the hospital, to do something for them. It's a time they be active. They should not think about death. This is very important thing which I want you, if you are old, to just keep in your mind. How much you take care of your health, you're not going to make your death later. You're not going to cause delay for your death. Death will come anyhow. This is not something in your hand. Not at all in your hand. At least till now it's not in your hand. Maybe one day as the earth and we grow, the science grows and we can do something. But that will take a lot of years. That is not something which we can do it now by changing the organ, putting something. No, even if we do that one also, we cannot change it. Death anyhow will come at the time it has to come, and we cannot stop it. Whatever we do, whatever medical help we give, medical assistance we give, we cannot prevent the death. Death will come. Then just please don't think about that one. Think that you should be on your feet. And don't think 1 year or 2 years or a few months. If even that person is going to live for another 6 months, he should not be depending on someone. He should be able to do his personal works. Because this one also I saw a lot. Many of these old people who they are extremely weak, they are thinking if they get some problem, it's fine. No, it's not fine. If that person is alert, if that person can speak, if that person can eat, if that person is okay, can any have difficulty move for bathroom and do some small personal things, that is much better than that person to be almost unconscious on the bed and they have to bring nappy for that person. They have to feed him with some pipes. That is much more difficult. And even in the finance, if you are thinking, many of the people, if they calculate, if they don't have insurance, they can see the amount of the money which they are going to spend for their health when they are old is much more than what they earned during their life. Then better every person to think about his health, her health, from the time which they have this knowledge. They should not ignore it, because health is not something to play with or make fun of it. Say it will make it will be okay. Maybe 1 day, 2 days you can just not take care about it, not to think about it. But it should not be prolonged. You should not just ignore your health, ignore your food, ignore your other issues for years. And many of the people, just from the childhood, they know these are the problems of them. But they can't understand exactly what is it. They know something is there, but they don't know what is that. See, some of the people are getting some pain in the heart, real heart. I'm not talking about the chest. It's the heart. But they should be worried or they shouldn't be worried. How much is going to be a problem for them? Or some people, they may think I have some problem and I may get cancer. fine. But how much is right and how much they should just ignore it and not think about it. That's what I always suggest people just from the time of birth. First, that's not for the people from the time of birth. I suggest for each parents, each couple that they want to get a child, they decide to get a child. Before getting a child, they do acupuncture treatment, that they be sure they give birth to most healthy child which is possible to get from their eggs and sperms. And after that, suppose we miss that stage, that child is born, from that time only we start the treatment. Whatever is wrong, we correct it. Sometimes something will be wrong. When we do acupuncture, we assist that. We just order that body, certain enzymes should be provided and certain changes is needed for this body to prevent some problems which may happen next year, which may happen another 80 years. We will prevent that one. Diet and daily works are in a person's hand, but acupuncture is not going to be bothered about this stuff. These are something that person should understand, will get a knowledge and have to do it. If they don't know it, someone can teach them very easily. It's not that difficult, because what body is needed, it's very simple thing. The body needs three things. First is protein, then is minerals, and then is vitamins. These three things must be there, and they can easily provide that one. How much the body needs to be active, how much your mind should be active, how much other things should be there. These are not something which acupuncture is going to interfere with that. Someone can just explain about what they are doing in their daily works and correct it if anything is wrong, or if they don't know it, just teach them. Acupuncture will correct the problems which are not in our hand. When the problem is not in our hand and we cannot help it, acupuncture will come and correct it. Think now we are having some genetic problem in our lungs, and we will understand this problem is going to cause asthma in future, or we know some problem is there in our kidney and it's going to be causing cyst in future. We will prevent that one. We are having methods, we are having techniques to prevent this one, but we have to detect it much before that. And if it happens also, if already happened, we have to prevent that one. And when we come to the old people, many of these problems already happened. Some of them already happened and finished. Think that person had cyst long back in the ovary and it's over now. Neither ovary are active, neither uterus is active, and it's over. That person is 70 plus, and many of these problems already got finished. But some others maybe is there, like maybe that person have cysts in the brain, maybe that person is very sensitive to get some other diseases. All these problems are going to be controlled. First step is we will make it as healthy as possible. Each organ, each molecular reaction, as I told you, we will correct it. If certain genes are going to be getting out of our control, we'll correct it. It's the same thing for the cancer people in the old, which are old. And since I had this type of patients, and children also were telling anyhow is old and maybe another few months is going to live, why we should pay for that person when that person is old and is not earning any money. In many of the countries, old people don't earn anything also. But we should spend for that. They can manage with that. Maximum is we will pay for some painkillers. But it's not that. We should think that person also is going to live for how long, has to be active, not to be left somewhere and just think about death. No, it is not at all right. And if you are that person, and right now you are hearing me, you should understand that life which is given to you, it's just a gift, and you have to prize that gift. You should like that gift. You should use that gift as best as possible. Take care of that gift. If you are now sick on the bed, you're suffering of some diseases, they left you over somewhere, they're just giving you painkiller, or they did some surgery for you and left you some corner, just think that you have the right that to get up on your feet and let's do your healthy, your some of your works, how much is possible to do. Open your eye, can speak, can eat, can do something, not to be somewhere and hear many things from many people around yourself, or maybe you just think it is. See, sometimes the people around you who are taking care of you maybe really love you, but you may be thinking that they're not doing it through love and it's difficult for them, whatever. This is some emotional things, but I'm not talking about emotional things. I'm telling you, this is your life. In any stage which you're having the right that to be on your feet and do your daily works, not to be depending on someone. And if you are better than that, if you are just a healthy old person, you should take care of yourself just now, and don't think always just food and some exercise can help you, because that food also is very important. According to me, old people most of the time are taking some diet which is absolutely wrong. It is not having any protein is not there, means enzyme is not there, means tissue cannot build itself, tissue cannot keep its own health. And in most of the diets for old people, proteins is going to be getting cut. And we will speak about this dieting little now. This vegetarian diet which they may give. See, first of all, main thing is people should accept the fact we cannot just fool ourselves. If you take a group of cows, a group of sheep, a group of deers, and give them meat, you give them meat for another 500 years, 1000 years or so, their body doesn't get used to that. Maybe also gets, but basically it should not get. Their body made in such a way, they eat grasses and their body will collect whatever it needs from the plants. Human body also needs to take something from some other sort of foods like meats, and it has to be there. If it's not there, we have to provide in some way for body. And many of the plants which we are eating, body is not capable of extracting and using the protein and vitamins and minerals which is there in the plants. It is there in the plants, but human body cannot extract it, cannot use it. It is going to be just eaten and throwing out. It's not going to be used by human body. We cannot make full of ourselves. Maybe you see somewhere that they say, I changed my diet, I became vegetarian and I became fully healthy. But you just think the other ones which they say we are non-veg, we are eating meat and they are unhealthy, what type of non-veg they are taking? Maybe they are taking only once or twice in a week, and that one was a little. Maybe they are making the food, but when they are making the food, most of the time they are just eating the rice or eating the bread or eating some other vegetable around, and the meat is going to be kept aside. Maybe they are cooking it in the wrong way. You just go through the correct diet of them. See really what type of food they eat and how much of that is having protein. Most of the people, when they complain about some sickness, actually it's not sickness, it is just mistake in their diet, and you never think they are having non-veg, that's why they are sick. They are not having good food at all. That's why they are sick, not they are having non-veg. Something is less. Like you come to me and I have to tell you go and eat certain foods. Your body is completely healthy. And many of the people are like that. Acupuncture is not to treat the problem which is from diet or from some other source. Acupuncture is to treat the problem which is basically from body itself, from genes, from enzymes, from other molecules, from proteins, and which is out of your hand and you cannot maintain that one. When we go through acupuncture will just help the body to change according to what we need, make it healthy and maintain the health after that. And for all people it's very important to just try acupuncture, not each acupuncture. Acupuncture is not just putting needle. Which needle and what is going to happen? One thing I want to tell to everyone, if a person doesn't get cured by acupuncture, be sure is not going to get cured by any other system. That is one thing. And acupuncture treatment is very fast. The first day only you do acupuncture, you should feel the changes. It's not that you have to wait for long time, unless some of the programs are there that is going to take long time. For example, the knee is gone, and for treating that the body is too weak to provide the materials which we need to build up that knee, and it takes time. The speed of providing those materials is very less. That's why it takes time, and we know exactly how long it's going to take time. But apart from that, acupuncture is very fast. If any other treatment is going to even cure any problem, for example, within 3 months, acupuncture is going to cure it within 1 sitting or 3 sitting or few sitting or few days or few weeks, much less than what you can get cured by any other system. If you do acupuncture and you're not feeling any changes, or your problem yet is existing, or you're getting just few % better or feeling good, that is not correct acupuncture. And the other thing I want to tell you about acupuncture is totally anybody press needle and put needle anywhere in any of the acupoints, generally that person feels good, that day feels good. Like if you for example you are having back pain, you massage it also, you may feel good. If you put needle also, you feel good. But acupuncture is not for that, to feel good. Acupuncture is for treating that problem. That bone, that cartilage, that nerve, that tissue should get healed. And all of them have technique, not the technique of needling. It has lots of ways that how we should do it, how we should repair it, which type of cell we need, which type of molecules we need, which enzymes should be provided. And many of these molecules which we need for healing are not, some of them are naturally inside the body, some of them are going they are wrong, like body is not making enough of them, or is not making the good quality of that. And when acupuncture comes to the picture and start the treatment, we'll make these molecules to be good, to be enough, and to be good, to be able to do the good job. Then I just summarize all this talk. For everyone, before doing acupuncture, we have to do diagnosis, and diagnosis for all people also is more important. For all people, we have to put more effort and more time. That, as I told you, it will take 2 to 14 hours to complete checkup. At least we should take 2 hours to diagnose properly, and based on that, we start the treatment. Only cooperation is needed from that person or the other people who are taking care of that old person, if he or she is not able to decide for herself. Then we start the treatment. We will repair and maintain the health of every part of the body how much is possible, and we will prevent further problems which may come, or we are sure 100% are going to come. And all of these problems are going to be detected in the first step in diagnosis only, or not something that we just want to imagine about it. It's very clear and very understandable. All the best. See you next.